We are here in Luxembourg on the Congress on Environmental Medicine of the European Academy for Environmental Medicine. Professor Belpomme, you gave an interesting, excellent lecture about electro-hypersensitivity. You gave us data, figures of investigations you made, which will help us to deal with this hypersensitivity with electromagnetic fields a lot in the future. You stressed that it is very important to look for the children especially. Why that?
Because I stress about children because they are more vulnerable to any types of environmental factors, including the electromagnetic field exposure. So why they are more vulnerable? First, because they are, they have cells in division. That means that they grow. So the tissue has to make a bigger mass, and so each time a cell divides, it is very vulnerable to any external environmental agent, because it can suppress or activate some genes, and so make mutations or epigenetic dysfunction at that time. So they are very vulnerable because they grow, and also very vulnerable. Their CNS, their central nervous system, is still immature, and so it is very vulnerable to. And the behavior of children is to absorb more environmental pollutants, because they are close to the ground, so their breath, they ingest particles and the chemical pollutants. So they are very vulnerable. And this is a case also for electromagnetic field, as I said. This is due to the immature CNS system. So they can create dysfunction of this central nervous system. But the vulnerability is also in any pregnant woman. At the fetal stage, there are some modification due to electromagnetic fields, which may be irreversible. So the people, the infants and the children may have some behavior problems and cognitive deficiencies.
I remember the Paris Appeal you started a couple of years ago, which was very successful. What is your message from here to solve these problems to the population, from the population side and from doctor side?
I think that as far as medical doctors are concerned, we should increase the formation, the medical formation, because we are dealing now with new diseases, new pathological disorders. So they are not familiar with these new pathologies. So we should organize intensive courses of environmental medicine, and I would like to thank very much you for the creation of the European Environmental Academy, which is, I think, a very important structure that can help for this formation, for this medical formation. So, but the problem is at the level of the civil society, and it's not so easy to convince children that they have to modify their behavior to decrease the use of cordless phone, and so we have to convince the political, the administrative and public and political authorities that we have to change this behavior and make recommendations to change this behavior in children. But I think that the main fight we have to organize is to convince WHO to modify its denial point of view as far as hypersensitivity and electromagnetic intolerance are concerned.
Thank you. Do you agree that a mighty sword might be education? Education in kindergarten, in schools, universities, and postgraduate doctors' education, for they are a very good distributor and they have an impact on families. So if we educate all this from the childhood to the doctors, up to the doctors, wouldn't it be a very good thought to fight against EHS?
I think that, the medical doctors have some responsibility for the education of the kids and children, but the parents have also an important responsibility to oppose the practice of mobile phone. But if there is no support from the no governmental support for that, unfortunately, this point of view risks to be unsuccessful. So I would recommend that civil society will take care about the problem and have some action to oppose the present, no decision which is made by politicians. So I would like to stress also that the NGOs are very important to collect information and to help medical doctors and scientists to make a type of revolution as far as medicine is concerned and societal practice.
Thank you very much for this interview. Thank you.
Thank you very much.